1021, welcome back. Well, May is officially Mental Health Awareness Month, and while depression and anxiety can improve with medications, sometimes the high-tech option may actually work a bit better.
Yeah, that's a little crazy to think about, you know? We'll talk more about this with Dr. Ali, who is joining us live now on Connecticut's Morning Buzz. Nice to see you again. So I have to be honest, I have a lot of questions surrounding this here. So we are talking about an app that is going to be hitting the App Store soon.
Right, this summer.
So this summer, helping people with mental health struggles. But my other question for you, why? Because we often say get off the phone, get off the internet.
Oh, and I'm going to talk about that because I think screen time is something we will definitely talk about. But this new app is called Rejoin, and it is the first FDA-approved medical device. So you'll be able to download it once you get a prescription from your doctor. And the reason why they have a prescription requirement is that a lot of people try to do things on their own. This is an app that you have to work with your provider with medication, because the study shows that it only worked for major depressive disorder, and it worked with medication and some psychotherapy. We don't want people just going online, downloading this app and figuring it out themselves. They need somebody to guide them through it. That's why it's prescription only.
And when you say provider, do you mean your PCP or a therapist, a psychiatrist? Because is this going to take away jobs and medical care that psychiatrists offer?
No, this is going to actually supplement. Actually, because this works well. The study that they did, you know, a lot of people are talking about the study that was performed by the company. It showed positive results, but the results were when you were working in conjunction with a psychiatry or a psychologist. So in fact, this will actually get people more in tune with cognitive behavioral therapy. You know, the app uses something called emotion regulation, reframing. It's a different type of modality of therapy. And this is different from just the talk therapy you see advertised everywhere.
Right.
And I want to mention that, you know, the talk therapy, the telemedicine option has been a godsend for so many people who can't get out to the therapist that frequently. But you got to be really careful about the type of therapy you get online. It has to be a certified therapist. I often tell my patients to, you know, do a therapy with your provider affiliated with a major health organization, such as Hartford Health here or Yale New Haven Health. Through MyChart, you can do the televisits that way. Some of these online, you know, enterprises will say, we can prescribe medications for you. Be very careful. The FTC, the Federal Trade Commission, actually sanctioned one of these startups because they weren't keeping the patient's private records private. So I always tell people to really do your homework and stick with maybe a major health, you know, system where you can trust. That being said, you mentioned screen time. And, you know, summer vacations here, kids. So the American Academy of Pediatrics suggests that under age 2, no screen time. 2 to age 12, 2 hours, I mean, 1 hour a day. 1.5 hours maybe. Teens and adults, no more than 3 hours. I think we spend a lot of time on our phones, and it leads to emotional isolation because you can't get that meaningful connection with a human being as you can in person. And children are getting a lot of self-esteem issues, body image issues, because they're trying to look at life through a filter. Whatever you see online, it seems real, but it's not. It's all through a filter or the way that the person posted, you know, their picture to be. And I think to get that meaningful connection with people, I mean, I know from my job, working in a nursing home as a geriatrician, I have my patients use FaceTime and all that, but it's not the same. I'd say, put down that iPad. Let's get out. Let's go to a senior center. Let's do an activity. Let's play bingo.
It's great advice. But before we go, I want to let our viewers know a little bit more. So the app coming out this summer, do you know which month?
I don't know exactly, maybe July. It will hit Google Play and Apple Store. But when you download it, it will ask you for a prescription code. So you need a prescription from a healthcare provider, preferably a psychiatrist. I think a primary care physician may be able to prescribe it as well. But you should be doing it in conjunction with a
So
greater...
people can bring this up to their doctor, say, hey, I heard about this, thinking this might be a good fit, and then they'll go from there.
Absolutely. And one more thing for children and screen time, go to healthychildren.org for more tips from the American Academy of Pediatrics.
And quickly, before we head to break here, just give us 3 quick tips on how to improve our mental health. You know, I know, like getting outside, exercise, as we head to break here.
I think exercise, getting sunshine.
Like
Staying
today.
in the dark is terrible.
I know.
You know, people, radiologists who sit in the dark rooms looking at x-rays all day, they're the most depressed doctors out there.
Or those people who wake up before the sun.
Couldn't
Way
couldn't
before
be
the
us.
sun, that circadian rhythm up.
Yeah.
As always, thank you for your time.
Thank you.
Nice chatting with you.
All right.